has been considered a second-class citizen in the realm of restorative dentistry. And what I mean by that is, over the years when I started to teach, nobody believed that this would work. And I knew it did. And I knew why. I knew that it was, not only did it combine, you need the right materials, but you needed the technique. It is a technique-sensitive situation, and it's something that's really undertaught in many areas, undertaught in dental schools for sure, and it's undertaught in as far as the meetings that you go to, especially the cosmetic meetings. When you look at the cosmetic meetings now, the emphasis is placed on implants or full coverage with porcelain, and in my mind, it downplays composite. There's a very small role in each one of these areas where they do present, but they don't present enough. And this is where I come in. I feel that it is equal to, or really more important than anything else you do, because this is bread and butter dentistry. This is where it's at, whether it's posteriors, whether it's anteriors. I don't care if you ever do another composite resin veneer, but don't let anybody ever tell you that you can't, because I know it's beautiful, and I'm going to show you those results. But when you look at the versatility of what can be done with these materials, it's unbelievable. So that's what we're going to do, is to show you technique-wise what can be done with these materials and show you the multitudes of areas where you can use this composite. In fact, I hope that when you get done, we get done with this 3 or 4 part presentation, the people out there will start to think out of the box and develop techniques that use composite in ways that maybe I never did think about. So this is what the purpose of the presentation is all about. And with that in mind, let's go through what we talked about as far as my feelings towards this. So why direct resin bonding, Dr. Mopper? Why do you believe in it so much? Well, first of all, let's look at what it does for you, okay? Let's look at its advantages. Number one, you have complete control. It's the only material out there in dentistry that you can control, and it won't do anything until you tell it to. You think about it, you place it, you shape it, you form it, you look at it, make sure I add a little more, should I not? You polymerize it, then you look back and say, do I need something here? Do I need something there? Or even when it's finished, when in a mouth, you would control your own destiny because it's totally repairable and it's easy to do, okay? It's the most minimally invasive dentistry that you can possibly do. In fact, some of the things that you don't even have to do preparation. And so it's not destruct in order to construct, it's construction and with ultimate preservation of tooth structure, which in turn really preserves the tissue results, the small tissue results, and the surrounding areas around these restorations. It's versatile, the most versatile technique that you can use, and I'll show you that as we go along. It's creative. From the dentist standpoint, when you can do it and do it well, it's totally unbelievable. It blows your mind. It blows the mind of your patients and the people that are working with you. It's motivational for everybody because you get to see it. You get to see what can be done. And when the patients see what you did, okay, they will go out and tell your people around them that are their friends, and you'll have patients flocking to your office because of what you're able to do. It's motivational for your staff as well as your staff. And one of the reasons for the motivation is the instant gratification. I mean, you get to see it, they get to see it evolve. They get to see what you've done instantaneously as you do it. So do you. And so you don't have to wait for the results. You have the results in your own hand, and you can change those results on the spot. The material is easily repairable. And that's one of the things. And not only that, it's the only material that you can repair in the mouth. And it's the only material that you can repair other things like metal or porcelain and composite in the mouth directly. And it's easily repaired. And we're going to show you repairs of all types as we go through this. It's profitable because you don't have a third party. You don't have the lab involvement. And believe me, in my practice, we use the laboratory all the time because composite's not for everything. I mean, there is a need for the lab. I'm not trying to take the lab out of this, but it's a profit-centered zone because you don't have that third-party cost. You don't have impressions. You don't have a lot of things that you have to take. It's just you, the material, the application, direct apposition, and you're done. and it's a practice builder. When you do it well and people see what you can do and you create invisibility, that's what we're going to talk about, are invisible restorations that look like two structure. It blows people's minds and it will build your practice so fast, it's unreal. And it's fun to do. I can't tell you how it increased my enjoyment, although I've always loved dentistry. As a pediatric dentist, I loved it. But when this came into existence for me, it changed my whole perspective on dentistry. It is fun to do. It's fun for your patients. It's fun for your staff. Now let's look at the disadvantages. Well, there's confusion out there because every day or every week, somebody comes out with a new material that's a magic material. I don't believe that. I believe you need a group of materials in order to get the right results. And it's not just the material, ladies and gentlemen, it is the technique. And the technique is more important than the material. And you need to know the technique in order to get the results. So, but it's confusing. And then there's people out there that are terrific, they do great jobs and they're beautiful, but they lecture, but you can't replicate what they can do. With me, you can replicate everything I do, okay? And that's what we need, is something that's simple and you're able to replicate it every single time you do it. So there's misinformation out there, lots of it by the industry, maybe by some of the lectures that you're going to, and so the misinformation can lead, the confusion of misinformation leads to unpredictable results, okay? Now, they also say the longevity, it doesn't last. Well, I'm here to say it does, okay? It's not durable, it is durable. And it takes too much time. And I'll put all three of those over on the other side in a second. But I've left out one aspect that I said before. And I read articles that are the peer-reviewed articles by so-called evidence-based dentistry that it only lasts, that in terms of longevity, composite restorations only last 5 to 7 years. Well, I don't know whose practice they were testing, but I've challenged universities to come in and challenge my practice now, which is Dennis Hartley's practice, to look at our practice and look at the longevity that would blow their mind. Because for us, it's really a lifetime proposition. So as far as longevity, the way I see it, they're wrong. Durability, yes, there's some fractures, but there's fractures in everything. The thing about it, that you can repair it. And I should have more fractures in my practice than anybody because I did more of bonding than anybody else, but we didn't. And the color stability of the material was so great that every time we did have a repair or something like that, it matched perfectly. And time, let's talk about time. I don't have to take impressions. I don't have to fight gaggers. I don't have to send my stuff to the lab. I don't have to do remakes. I don't have to do wait for the stuff to come back to the lab. So as far as time is concerned, it may take a little longer or it may not. It depends on whose hands are doing it. But I think time is on my side also. So if we look at this, what we're going to do today is we're going to simplify this thing and we're going to make it simple, predictable, and long-lasting. That's what you should be doing. I think many of the techniques out there that you are exposed to are very difficult to replicate. Mine aren't. They're going to be easy to replicate, and we'll show you. And what our techniques lead to predictability and long-lasting results. So how are we going to do this? Well, first of all, you're going to see my concept of direct resin bonding. It's different than most people's. There are a lot of people that utilize it. We have thousands of people who are doing it. And then we're going to discuss today's material, and there's a place for all of them. We'll describe that in a second, and how to best utilize it, where they fit, where all these materials fit in the bonding scenario. And then we're going to show you step-by-step long-term techniques and long-term results. And that's what you're going to see through this presentation. And That's where we're going from here. So what's my concept for direct resin bonding? Well, let's take a look. To understand it, let's take a concept of what's most frequently used. You're replacing two surfaces aesthetically and structurally. One is the enamel, one is the deadening. Now, the two materials that you're using today, and the one that you're probably using the most today, are nanofill. It used to be microhybrid, and I have to explain this because there is another material out there, which we'll talk about, which came first, okay? But these two materials were made to be universal, all right? And so what they did, and they used these materials because of the physical property, but the aesthetic properties took a second place. Took second place as far as I was concerned. Okay, so they're using either one system to try to make a universal system. Okay, to get everything. First it was microhybrid, which was a failure. It didn't work aesthetically. It stained, it plucked, it wore. All the things they said it would do, it didn't do. Then they transferred to nanofill, which is either a nanohybrid or a complete nanofill. But what they didn't say to you was that there are larger particles in there, and then what these larger particles do, I'll show you in a second. So in my mind, okay, this is the way I see it. The enamel is king. What material is going to replace the enamel? And that is microfill. Now, which came first, the chicken or the egg? The microfill was here way before the microhybrid, which was an attempt to knock microfill out of the box, or the nanofill. The microfill is the king. It is the enamel, as far as I'm concerned. It is the Stradivarius. It is the diamond. They're trying to reinvent the wheel. And we'll talk about what makes microfill so great in a minute. But microfill, when you're doing the replacing the enamel surface, especially on the facial or buccal aspects, that's where it belongs. That is microfill. As far as the deadening is concerned, you can either use microhybrid or nanofill, and we're going to discuss the characteristics of both right now. Okay, and now for me, the physical properties are important, but when you're talking about aesthetics, that's where it's at. And I want the most aesthetic material that I can have, both the refractive index, reflective index, color stability, and everything else. And polishability, you can't beat it in its polishability. So microfills are where it's at. So in selecting the composite materials, let's look at the advantages of what microfill brings to the scenario. It has a smaller uniform particle size, 40 nanometers, and what does that do? It probably increases its refractive index. We're not quite sure, but one thing it does for sure is it creates superior handling. This is the best handling material on the market by far, and all the other materials, handling of the other materials, were copied after it. And when you place this stuff, it doesn't slump. You can place it where you want it. You can sculpt it, shape it, and we'll go through what temperature does to these materials later on. But it's an unbelievable handling material. And this polishability is unsurpassed. There's nothing that polishes like a microfill, and there's nothing that maintains polish long term. This stuff will maintain polish through a lifetime if you use proper maintenance habits and toothbrushing habits, and we'll talk about that later on in the presentation. It's easier to marginate because of its uniform particle size and its spherical particle. In fact, you can marginate it up into the tooth surface, and you can't even find the margin. You won't find the margin, and it'll marginate into the gingival, it disappears, and it's so kind of the gingival tissue, it's unbelievable. It's more, as a result, it's more stain and plaque resistant, more biologically compatible. It has better wear resistance because of its small particle size, and has a better reflective and refractive index. It's the one that really replicates enamel better than any other material out there. And it has a realistic translucency and a transparency that will let things come through from underneath. And we'll talk about that when we discuss the value of papers and tint. And it is more flexible, so that when you put it in areas where the tooth bends, like at the gingival surface, it will have a tendency to stay on rather than pop off or deflect its margin, things of that nature. And we're going to talk about that as we go through the presentation. So you look at the advantage of the micro and say, wow, that's really amazing. And it is amazing. And I can tell you right now, I've been using it for like 27 years, and it's the same material, and it's blown my mind. Okay? And it more closely simulates enamel. So microhybrid, what are the properties that make it great? Do I use it? Yes, I do. Let's see where we use it. Has a larger particle size. What does that lead to? Greater strength. And I need greater strength because I need supporting material for overlaying materials, okay? It's more opacity. And the beauty of this, of our microhybrid, the one I use, is it has excellent wetting properties, which means it has a little more slump, but it's still very strong. In its wetting properties, it means I can block out and use the opacity to block out undercolor in very thin layers, which makes opaquing much easier rather than have to opaque the entire thing. And we'll go through this as we go through the whole presentation. It has a decreased polishability. It will polish, but it won't hold its polish at all. Does not maintain polish long term. Is less wear resistant to flux. It will stain at the margins. More difficult to marginate. It doesn't have the flex, by the way, so it will pop out at the gingival and it will stain at the gingival. And that's what they found out with these flowable microhybrids. They didn't work. They were failures. So we're going to talk about how to get stuff down at the gingival that does work, okay? It's less refractive and reflective, and it more closely because of the first three aspects: larger particle size, greater strength, more opacity. It more closely simulates the depth. Well, this was the first attempt to make a universal material, which failed. And so out comes nanofill. What is a nanofill? Well, it is both a small particle and large particle size material. And this is a clinical material science. You need to know this, and they don't teach this very often. But it's got minute particles, even some particles that are much smaller than the uniform particle size in a microfill. But they're also embedded in their larger particle size. Why? That's because it makes of strength and increase the handling properties. Because if you did all small particles, it'd be so sticky you couldn't handle it. So they had to, so for that reason, they had to have those two reasons. They had to have the bigger particles in there. Okay, so what does it have? Larger particles surrounded by minute particles, and every one is different. You can have a nanoparticle material or 3M Filtech Supreme, which is all nano. But you look at the Filtech Supreme, it still has to agglomerate those smaller particles into larger particles to give you the handling properties and make it not so sticky. So that's what it is. It has excellent handling properties. It's as good as a microfill, not in my mind, but it handles very nicely. It has increased strength over a microfill, but it's not as strong as a microhybrid, but they're fairly close. It has increased polishability over a microhybrid for sure. Does it hold its polish longer than a microhybrid? Yes. Like a microfill, doesn't come close. It just won't hold its polish long term. Is it easier to marginate? It's very easy to marginate. One of the reasons is because it has decreased shrinkage. So you could close down margins with it and then overlay it with a microfill to close it down by itself. But I will tell you, it is easy to marginate and the decreased shrinkage helps, especially in class 2 restorations where you're working with the posterior. It's an excellent material to use in the posterior, and one I did use it most of the time. And what is it? It's more stain and plaque resistant than a microhybrid, but not close to a microfill. Nowhere near. And you'll see it over time. We'll show you that over time in the ones that we've used. It's more biologically compatible to the gingival tissues of a microhybrid for sure, but it doesn't compare with a microfill. It has an opacious translucent quality. What do I mean by that? Sort of a word I invented, opacious, I guess. But what do I mean by that? It means it does have a tendency to block out. So in lighter color changes, you may be able to block out and not have the necessity for other materials like opaques we're going to discuss in a minute, and we'll show you how that works as we go through the presentation. So and its handling properties make it very nice, especially at the incisal edge. And you'll see that its handling properties make it so that you can add to an incisal edge and stands in attention. We'll show you the difference between how our microhybrid works and nanofills work as far as that's concerned. So that's today's universal material. If you're looking for a universal material, nanofill is the way to go. And there's a bunch of them out there, and all of them are very good. I think you need to pick and choose. Complementary materials, opaques. How many use opaques? I don't know how, but you should be using them. They're so invaluable in your practice, especially when you're using microfill and we're using these techniques. It's unbelievable. How do they work? Well, they should produce opacity. That's what you want. You want to increase the translucency or change the overlying color. You need that block out the capacity to do it. But at the same time, they should color blend. You want them to produce opacity by color blending at the same time, so that they actually are the same colors as your materials, and we'll discuss that in a second. They block light transmission and excessive translucency. That's what they're used for. Their value increases. You want to increase the value of something, you're going to use an opaquer. It does it so rapidly in ultra thin layers. It's an amazing quality. And it's used to mask dark areas. It's used to mask metal. We have a special one that works as pink opaque. We'll discuss that later on. Should be used sparingly off the tip of the brush, and we're going to show you that as we go through our techniques. And they help create invisibility. That's what the opaquers are for. The object of doing these restorations is to make them disappear. That's especially aesthetically. And this material will help that so immensely, it's unreal. Okay? Now, tints. I don't imagine a lot of you using tints. Maybe some of you are, but they're valuable. What do? They increase hue and chroma. They create the illusion of translucency. They must transmit light. In other words, they must be clear but colored. It's to let the light come through. You don't want them opaque, because then it'll look like a blob of color. You want to look like a misty look of color coming through, where you make these subtle transformations of color from the incisal to the body to the gingival, and that will create the real illusion of what tooth color is all about. They're value decreasers. You want to decrease the value of something, use color, and they should be used sparingly. This is what I see these materials. And so why do I need them all? Okay, well, actually, I forgot one thing to help create the realism of enamel from within the enamel surface, which is where the color comes from anyway. Okay, so why do I need all 5 materials? Well, let's look at that. The microfills, they're enamel. That's why I need it. And anywhere I've got exposed enamel, especially from the anterior, I'm going to use microfill, because that gives me the best refractive index, best reflective index, the best overall color, the best translucency, everything you're looking for in the enamel surface. When I need strength and opacity and universality, I'm either thinking nanofill or microhybrid. When I need opaquity and color blending, I'm going to go to the opaque materials. And when I need tints, which produce hue and chroma, I need tints. And it'll do it rapidly for you. Rather than embedding one material in another to try to change the color, we develop the color from underneath, which shines through. And it's invaluable when you're using microfill. The other materials, the nanofill and the microhybrids, are too dense, and they don't let these tints shine through. So that's the value of these things. So let's talk color. All right? Let's look at how I look at color. Now, to do that, we got to look at the most common procedure again. Here we have an A1 tooth, and let's say it's fractured. Now, in the other system, what they're going to do is they're either going to use a microhybrid or a nanofill, and it's going to be dentin colored, okay? And it's going to be the color of dentin. The next thing they're going to do, they'll say it's A1, but it's not A1. It's an A1 dentin, which is a dentin color. Then they'll use a microhybrid or a nanofill to over the top. And it'll be a clear material, but a colored material, to try to neutralize the material they put underneath it. And many times they end up, when they're finished, it looks okay, but when they come back, there's a demarcation. Either it's too translucent or the color affects the overall thing. So what they're working is from the inside out. They're doing the dentin, they're trying to get another color that will go over the enamel, over the dentin, to neutralize it, to make it blend to the third color, which is a tooth surface. So they're going from the dentin to the enamel to the overall tooth surface. So what we do is we say, let's keep it simple. Let's build to the external shade. So I look at the tooth and I say, it's an A1. And I say, well, give me a microhybrid or nanofill, it's A1. In other words, the color's there. It's an A1 color, only the opacity is different. So when I place it on the inside of the ledge, usually it's still too translucent, because if we make it too opaque, it'll be too the opaciousness will come through. So we want to be on the underside of the opacity side, or right there to match, which you'll see. Okay. Now, if I can't quite get a match to it, then I'm going to use my opaquer, which in very thin layers over that lingual shell will block it out and give me the color I'm looking for, which is an A1 opaquer again. And then we use the A1 microscope and overlay it, and we end up with, voila, we end up with the color that we're working for completely. So in essence, I'm working with the same color all the way through, only the opacities are different. And that's how we derive it at almost every time at getting a perfect match and having it stay that way. So what's the key to making this concept work? Well, here it is. The microfills, the microhybrids, the nanofills, the opaques, they match each other. And in our system, it matches a selected shade guide. And that's the Vita Shade Guide Classic, and that's a porcelain shade guide. But what it does is it marries tooth to composite to porcelain, and it works almost every single time. In my hands, it worked every time. And this is what makes it work, because all the shades match one another. Only the opacities are different. In addition, we have incisal shades and matching flowables, and we'll talk about that as we go through our techniques. So this is what this system is all about. I talk about it. This is a system that I've developed over a period of years, and I talk about the system. Are there other systems out there that you could use? Maybe. But the thing about it is that I can't make excuses for making a really great system, and I won't. There are other systems out there that you can work with that are great, and if you can work with them, fine. I'm not trying to change that. But this is one that is so reliable over the years, it's unbelievable. So with that in mind, let's talk about what the opportunities for today's restorative dentist is. Then let's look into the possibilities. And when we look at the possibilities, look at it. Class 3, Class 4, invisible Class 5, all invisible. Incisal reinforcement, diastema closure, enamel defect. We'll go to the other side, veneering, custom rights, reshaping and realignment, repairs. It's not just me. I'll show you other masters out there that are much better than I am, and I'll show you their results. It's unbelievable. We're going to show you long-term results. We're also, if I can find this thing, we're also going to show you, and later on, these different techniques involving nanotechnology and all the things. You can look at the screen, take a few minutes to look at the things that we're going to discuss. And I would implore every one of you, if you can, to try to take this 3 or 4 part series. By the way, we had so many questions at the end of our first session that I know there's a myriad of questions out there. So we may be planning a 4th session where you can ask me any question you want. I can take you into my presentation to answer them if need be, and we'll stay on here till all the questions are answered, because the questions were mind-blowing. There are so many of them, unbelievable. So as we go back, let's start with the invisible Class 3, because this is the premise by which everything works. You understand this, and at the invisible Class 4, you'll understand everything. Now, like I said, if you get to the point where you never want to do veneering, I don't care. That's your call. You want to stay with porcelain, that's fine. But don't let anybody ever tell you that you can't do composite veneering and it doesn't last, because I'll refute that all day long. They tell you that, it's either because they can't do it or they don't want to do it. I'm going to tell you that it's unbelievable, and I will show you that. I'll show you long-term results. But let's start with an invisible Class 3. Here we are with a simple lesion, and you notice on the adjacent lateral, okay, on the adjacent lateral, there's a little hypoplasia. And what I did is I fixed that first prior to doing the class 3 on the canine, okay? So I repaired that. I did them both the same day. I polished it, and I'll tell you why I polished one before I did the other in a second, and we'll go through this technique. So I see a lesion like this, and I look at the lingual aspect, and I say, you know, that lingual wall is not effective, not at all. Well, if I can leave, and no matter how small the plate is, of lingual enamel, that's only going to reinforce that thing, because this is adhesive dentistry. This is not old dentistry where the material doesn't adhere to the tooth surface. So you're just going to support this. So my attempt is something like this. When I see it, is I'm going to attack it from the facial. And being a pediatric dentist, which I am, okay, I'm a board certified pediatric dentist. That's where I started. I'll open it with a 330 burr. It's a great little burr, high speed. I clean it out, take a look, and that's pretty messy in there. So I'm going to clean that out, and I use a spoon excavator. I like to excavate with a large round burr. And the larger I can use, the better. And it depends on the size and what size burr I'm going to do under slow speed, high torque. And you peel that out just like you were peeling an orange till you get to a solid wall. And to make sure I get rid of any biofilm, and somebody asked me that how do you get rid of the biofilm before I start? Well, the way I get rid of it is every one of these cases, we clean them up perfectly, and we wash them thoroughly. So we do a prophylaxis before we start, and clean the enamel surface. And then in the interproximal, which you see here, after I've made the penetration of the tooth surface, I'm using a fine, superfine diamond strip, which is about 15 microns, to clean off the plaque, because I don't want to bond the plaque. Okay, so once we've got that done, now we go to the cable surface, and I'm going to create a long bevel, and I always do, and I don't make it serrated, because that's difficult to finish too. I make a straight bevel, and you can see the size of it. It's about 2 millimeters, maybe a little smaller at the incisor, but that's the way it looks. It's nice and clean. And I'm going to bring the material, when I place it, past the long bevel, and I'm never going to come back to the beveled margin, because if I do, when I finish, I'm going to open up a demarcation. I want it to feather edge material down on the tooth surface. This is all technique, ladies and gentlemen. It's technique that I developed over a series of time, and I know I didn't have anybody teach me. I taught myself, but I've had 50 years of experience with this stuff. Okay, so now I place a mylar strip. Now, there was a question. You don't use a rubber dam? No, I don't. I work on impeccable tissue. I will not work on anybody when their tissue is inflamed. That's the one thing I demand, because I don't want a rubber dam to use, because it desiccates the tooth so much. I don't know where I am when I'm finished. I can't see tooth against face. It just gets in my way. But if you want to use a rubber dam, that's your choice. If you want to use retraction cord, that's your choice. When I've got good tissue, I don't even use retraction cord unless I'm doing a crown or something like that. But if I have bleeding and things of that nature, I take care of that. I retract method-gingival. I clean it up. I will go use an astringent and things of that nature in order to do that. We'll discuss that as we go through the technique. But here's a mylar strip attack, and no, I won't place a wedge, because a wedge gets in my way. Okay, so I'm going to place that to acid etch, just to protect the adjacent tooth. All right. Once I got the acid etching done, then I place my bonding agent so it doesn't get on the adjacent tooth. Okay. Now you can see I've got an acid etch, and it's nice and etched. I don't care how far you take it over the tooth surface, but that's the way it looks. The prep is a little bit stained, but it's hard and solid, and that lingual wall is intact. Now I place my bonding agent and air thin it, and once I've done that, and this is dentin enamel primer, I air thin it, not blowing it all away, but leaving a nice glossy appearance. I remove the strip. People say, why do you remove that? Because I got finite instruments that I'm going to work against the curvature of the tooth. You can't work with a straight line against a curved line. You need to be able to manipulate that instrument along that tooth. And if you're taking it beneath the free margin, you need to be able to slide that instrument down. You can't do it with a straight line. And I don't want to leave flash. I don't want to cause bleeding and things of that nature. And you notice my tissue is still healthy. So we got the bonding adhesive intact, and now we're ready to place our material. And in goes what I'm doing here. It's a deep access area with a very deep color. So I'm going to use the most opaque material I can use in there. In this case, it's a microhybrid. Yes, you could use nanofill in there, but I know I'm going to have too much discoloration. I have to use opaquer. Maybe there's a chance when I use the microhybrid, I won't have to use opaquer. So that's what we do. Okay. So we place it, we sculpt it. And how are we sculpting it? We're sculpting it up to the leading edge of the long bevel, thinning it out so you've got like a micro edge in the inner proximal, which means that you have basically a long bevel which now goes from the inferior edge of the long bevel all the way into the interproximal, which when you do that, it leaves room for the other material you're going to put on there. What is the other material I'm going to put on there? As you can see, this is blending beautifully to the tooth surface, and I'm not going to have to opaque it. If that wall wasn't intact and it was a through and through restoration, chances are no matter what I put in there, I would have to put on opaque to bring up the value. We'll show you that in the class 4, okay? In this case, I didn't need to. I'm sculpting to the leading edge, creating an extensive long bevel. And I use an instrument what I'm showing here is I always clean my instruments to keep them so that they're free of material, okay? So you want them to be clean and then you want them unblemished. You want to make sure that these instruments are not scratched and things of that nature, because if you put it on the material, it can get pulled back and you can get pitting. This is another way you keep from pitting. Also, you don't compress the material with the instrument, because if you compress the material with the instrument, you also get pulled back. The way you use the instrument is to use it like you're spreading butter. Thin it, slice it, and make that instrument work for you. And don't use compression, because that's the most. You don't need to compress this material. It's already been compressed before you as it comes and being put in the syringe. Now, here's the microfill going over the top. I do use my fingers. In fact, when I do a veneer, I may use my gloved finger to roll it, shape it, and everything else. We'll discuss that as we go along. You'll see it. But here I make a convenience for them, because that's the elliptical shape that we're going to place. I don't just want to extrude the material, place it on there. I want to pre-blend it and be able to do it. People say, do I heat my material? Can you use a heater? Yes, but don't overheat, because you'll have a sloppy mess. I just warm it up in my hands and the material works beautifully. So I don't heat my material, okay? And do I have a heater in case I need it? Of course I do. Okay. But now you can see, there's your long bevel, and I'm gonna place this material past the long bevel and thin it out to feather edge it over the tooth surface. So we're gonna place it now, and the instruments I use today are titanium coated. You're gonna see some cases in here where I didn't have titanium instruments. And these instruments are instruments I designed, and they're unbelievable because they have different thicknesses and different shapes. And this instrument you see right here is a G3. It's a rounded instrument. That's an instrument that's made to spread the material and blend it over the tooth surface. I do not use my micro-thin instruments to do this most of the time, because they will impact in the tissue or in the material and make it more difficult, I find. So in order to get it on the tooth and spread it very nicely, I will go to either the G3 or the 8A instrument, and you can see I'm blending it down to the tooth surface, blending it past the long bevel, shaping it. Now I transfer to my eyepiece instruments, and usually I use the eyepiece short more than the eyepiece long, and you can see it's micro thin. It's like a scalpel blade. And that will get me into nooks and crannies you can't believe. And I can take that down beneath the free margin. I never get ledging because I've got the manipulate. I'm able to manipulate it beneath the free margin of the tissue. And I don't want ledging down there. And that's one of the things that if you put a wedge in there or something like that, or you're using a strip, you may have flashing down there. I don't want any flashing. I'm able to get rid of the flash with the utilization. So there you can see it intact. And now once it's polymerized, we're ready to finish and polish. And I like our discs. Our discs are great to start with, which are the flexi discs. There are other disking systems out there which you may use. The beautiful part of our disking system is that from the coarse through the superfine, it leaves no scratches. And we'll talk about that as we go, what the advantages of it as we go through it. I love the Versatility ET system. There are other systems like that. This is the one I prefer. This is the one I've been using for years. So in a case like this, I may start to get the original contours, whether you're a disc or an ET burr, okay, following the shape of the tooth. And we'll show you that, how I use my wrist to make these burrs work more properly. But you see the white line up there? People say, what do you do with a white line? Well, I never get white line. I just don't get it. And the reason I don't get it is because once I get to a stage where I've got a contour down to two surface and feathered it out as much as I can with this burr, the ET9, which is the 12-footed burr, then I'll transfer to the coarse disc. And the coarse disc is a 6 mil back, and it's flexible, and you can put compression on it, and that'll wipe out that white line you can't believe. It'll wipe out the raised areas. And the thing about it is, you don't want to go through the polishing system until every disc does its job. The purpose of the coarse disc is to get the contour, the shape, and the finish down on the two surfaces where the white line disappears. After that, then you transfer to the medium, and to the medium, go through it, using it, and flexing it over that lining. As far as the speeds that I would use these at, I would never use a burr, an ET burr faster than 40,000 RPMs, and I would probably use it slower. And the disc I'd run at this point where I'm at here, be running at about 15,000 RPMs, and I can take it down as low as you want. I can run it down to 2,000 RPMs. And that's the thing about doing it under slow speed, high torque, is you have control. You start doing this whole thing under high speed, you'll lose half of your restoration. You must have control. So we'll take it through, and you can see the flex of this, the 3/8 disc. They come in different sizes, 5/8, 1/2, 3/8, and you can see that even the 3/8 disc, I can flex it down towards the gingival, further defining that margin beneath the free margin. You can actually roll this underneath the free margin without lacerating it. And now I can go into the interproximal. When you attack the interproximal, you attack it from a perpendicular standpoint, flexing it over the line angle, and you'll see, and so that will preserve it. If you take the coarse disc and try to do it over the line angle, you'll lose your contact area. We don't want to do that. Through medium, fine, then the superfine. The fine and superfine will not cut, they only polish. Will just increase your shine. And then we'll retract back to gingival, look at the cervical. This is a 8392-016 burr. It's a mosquito-shaped burr. You can get it safe-ended or not. I don't use it safe-ended, and I retract back, and I can see. One of the things I did not emphasize enough, you need to see. You need to see your margin. If you can't see it, you can't do it. And 2.5, as far as I'm concerned, is not enough magnification. So if you're starting with magnification, go out and get yourself a fine pair of 3.5 to 4.5. I've always worked with 4.5X. And when you can do that, I don't want to feel my margin, I want to see it. Retract back, and I can hold down that margin at about 3,500 RPMs underwater. I use a water drop or a water spray, or I've just blown it away. And then, okay, once I've got that margin finished, then I'll go in and attack the contact area. Now remember, one of the reasons I don't have a strip in there is because it fills space. I have actually gotten rid of that space by sculpting the material in immediate contact against the adjacent tooth. If that tooth is polished and unblemished, it will not stick. It cannot stick. So through logically, I said it can't stick. So that I don't need it to, don't strip in there to keep it sticking. It won't stick. If you haven't etched the other tooth, you don't blemish, or the restoration next to it is polished, it can't stick. So all I did in the days before I started to use a saw is I use a thing called torquing. You take an instrument, you place it into the interproximal, and you torque it, and you'll hear a little pop in there, or there's a little adhesion. And if it doesn't go one way, torque it the other way. If it doesn't go when you're torquing it, believe me, you got stuff impacted on the lingual. Go in and clean out the lingual. This works every single time. Then you insert the fine, superfine diamond strip, take off little excesses for just a couple seconds and just excess, and then go with your aluminum oxide fine, superfine strip. And that's what this is, polishing the interproximal. And then we polish it up, followed up with aluminum oxide polishing paste. Our polishing paste is unbelievable. It's enamelized. There's nothing like it. Don't waste it. Don't make it messy. Just take a little dab of dew and put it on each tooth, and we'll show you how to do that. So you end up like this. Yes, there's desiccation in there, but not as nearly as desiccated as it would be with this is immediate post-op. And look at the tissue. The tissue is so healthy, it's unreal. And I haven't wedged it, I haven't traumatized it. And all I've done is retracted it. You work on a healthy tissue, and that's what you're going to get. And I know in this, because I compared it with the lower anterior and with my shade guide, that this color is going to be right on time when the color comes back. So that, ladies and gentlemen, is the whole premise of the whole thing. And you look through the whole system now, you'll find out it works every single time, no matter what restorative technique you're doing. So with that in mind, let's go through an invisible class 4. Okay, let's look at class 4. Here we have fractured teeth. You take a look at it, restorations you can't even find. How do we do this? Let's do it really rapidly, okay? As rapidly as we can. I'm going to give you the technique rapidly, but here's what we're going to do. If you take a look at this kid, and this is an old case, you'll see I don't have the titanium instruments. I don't think I will see in this one. But we're going to acid etch. If somebody asked me why I didn't do it, in the old days, we didn't even have fiber reinforced posts and things of that nature. So I used microhybrid. Worked fine. Acid etch. Used a Composite microhybrid. Now, I couldn't polymerize it all at one time because this is light cured. So I did a little bit, build it up, polymerize from both the lingual, and actually we used a 2 millimeter Dematron light tip, which we still use. You can place that tip right down the access area, and you can polymerize from the labial lingual. Okay. Once we've done that, now I can go to I guess we did have titanium at that time. So we go to our titanium coated instruments, which is the posterior instruments. And you can see we're bringing it up. Now we overlay with some more. We're still going to bring it up to the coronal portion. This is all the microhybrid. Blending it into the tooth surface with our burnisher, which is titanium coated. All these instruments are non-stick, by the way. And that's the way it looks with the canal filled. Now, you could use our Cosmic Core or core paste down there. You could use, I've never had one break, no matter what I use. The only thing I don't want you to use is metal, because that's very hard to restore aesthetically. Okay, and I want something that's adhesive. And so now we go ahead and we make our preparation. 6862 diamond, that's a brasser diamond. You can use whatever you want. Transfer to 5856 to smooth it up a little bit. On the where you see those spicules, notice on the central on the left side, the right side of your screen, that's nice and smooth. That's because I rounded it over with a coarse disc. On the other one, you can still see the spicules. I'm going to round that towards the lingual incisal to get rid of those spicules. Once it's done, this is the intensity of long bevel. I'm not going to veneer these teeth. I'm not going to mess with the integrity of the gingival tissue. It's in great shape. I'm not going to do it. I'm going to do a lingual prep, and I implore you, no matter how small your fracture is, whether it's on a lower central or an upper central, you always prep the lingual. If you don't, you're going to lose it. I'm telling you right now, you need that resistance to retention form. So I'm going to prep the lingual down to where I think I need it, the length I need it. You can see what I'm doing. You can use this type of burr, any burr that you think works for you, or you can use an OS1 burr, which is a pear-shaped burr. And you can get a modified chamfer, or you can have a butt joint back there. Doesn't deal with the aesthetics. And the thickness is probably maybe 5/10 to 7/10 of a millimeter all the way across. And that's what, but nice and clean and neat. Notice no retraction cord, none. Now we're going to acid etch. I've got when I'm acid etching, I got the strips in between, so it doesn't etch the adjacent tooth surface. Placement of my bonding adhesive. In this case, it's all on tooth surface. So I can do a dentin enamel primer. It was all in enamel. You could use the unfilled resin of the system on the enamel. Okay. Now, I didn't have the nanofill in this case. At the time we didn't have it. Today I probably would use nanofill on it. And if I use nanofill, and that's because of the way it stands. Now with our microfill, it slumps a little bit, so I know with our microhybrid, it slumps a little bit because of the wettability. So I know I'm going to have to, a fracture like this, I'm probably going to have to add 2 increments, at least. So I sculpt it, shape it, that's what we're doing. And I polymerize that area, and again, I'm sculpting it to the leading edge of the long bevel, okay? And I'm making room and thinning out the incisal edge to make room for the excess material. So now you've got a long bevel goes from the inferior aspect of the bevel all the way up to the incisal edge. So the incisal edge is going to be thinner in that area of composite because I got to have room to make room for the whole restoration. But that's going to give you the support it needs because of its strength and help with its opacity. All you can see, it's not opaque enough to block out. If I were nano, it would stand at attention like that. That's the difference in the way it looks. So now when you see this, you see I've got this translucency. How am I going to get rid of it? Well, I'm going to opaque it. And I'm going to start from the middle of the bevel. And that's where you start every time, whether it's a glass 3 or whatever it is, anywhere you got a beveled margin. You start from about the middle of the bevel and blend it out and make tooth and blend it. And you don't paint this, you sort of triturate it, and you'll see the movement of the material. It thins out, it's just beautiful. You can see how it's coming off the tip of the brush. So you don't want to put it on a blob. You want to be able to tease it and thin it out and make that disappear. You see, I'm using a brush to smooth that down into the middle of the long bevel. And once you're done, everything disappears. I've even left a little translucency, which you can see at the incisal edge to give the appearance of natural translucence. And if you wanted to tint that area with a gray or a violet, combination of violet and gray, you could do that. Some people use blue. I find blue a little too cold, but you could use blue. We'll talk about that as we go through the presentation. Once that's done, and remember, when you're doing an increment, you always polymerize the increment and then add to it, okay? Now, once that's done, on goes the microfilm. You're going to sculpt it, shape it the way we talked about before, cleave off the excess, and I'm using the broader instruments and the rounder instruments to do this prior to going to intersculpting my anatomy, which I did over here. Now, you could pre-sculpt your anatomy, which I do many times, okay, with the influence of my multi-purpose instrument, which you'll see as we go on, and my IPC, and all the instruments, or you can put it in your polishing. That depends on what you want, finishing and polishing. It depends on what you're doing and how you do it. In this particular instance, I did make the different lobes and the mamelons, and I created my nuances in my microfilm. And you can see how you can do it. You see how it stays at attention, how beautiful it is. And I polymerize it. Once we're done with that, we're ready to finish and polish. Again, it's the ET burr, starting with it. You can see the movements as I start to erase out the raised line and blend the material into 2 surfaces and get rid of the white line. Going on the lingual surface, I'll use the OS1, which is shaped like the concavity, so I can get a perfect result on the lingual. You can see the powder up there. When I'm using a burr, okay, you don't necessarily need to use water, or you can use water depending on you. But the one thing I do, you always wear a mask because you don't want to be the first one to go with a front and high speed evacuation, because you don't want to be the first one to go from white lung. Now, at this point, I might transfer to the 16 fluid. It's a beautiful blade. And at this point, I'm running, when I first start to do this, I'm running at a speed of about between 20 and 30,000 RPMs with the burr, okay, and those burrs. And then if I get to the ET, I can use it to define and smooth out the surface. I can even run it down to about 3,500 RPM. It's amazing how it rolls over the surface and how smooth it becomes. Going in approximately with the disc to define the disc, bring it towards the gingival surface to erase out the line and thin out that area. On the lingual surface, there's nothing like the rubber cups. Now, when you get to rubber, it's a different animal. On disc, you don't need to use water if you don't want to. When you get, because on this and the ET burr, but when you get to rubber, it really heats up the tooth. So you want to use it with copious amounts of water, either with a water drop or water spray. And you can see the water going on the tooth surface. So that's the rubber cup. And when we wanted to find the grooves and things of that nature, we go to the points, both medium and fine. And you could find with these points that you could create anatomy with them very nicely, just using compression with the medium rubber point and then following up with the superfine rubber point. So that when we get done with this whole thing, that's what you've created, an invisible restoration. With color, let's take the color out. You can see the translucency. And you can see the health of the gingival tissue. Now, we didn't have to go beneath the free margin, did we? Not at all. And that's the way it looks when it finishes a year. And look at the color match to the lower anteriors. That's what I matched it to. Okay. And a word about color. If you're going to check for color, I find that I look at my color under my overhead light. I look at the color under incandescent light. We have there's Advent makes a light that we also have in our catalog, and that is really great. They've got one they're coming out with that's even better, and it works with all white light, incandescent light, combination of the two, and it'll even show fluorescence, a new one. It's unbelievable. And it's a shade modification light. I tell you, it's wonderful because you're looking at all kinds of light. The only light I don't look at is north light, because north light bleeds out all the color. You don't want to do that. If it's so bright, you bleed out the color. You want to be able to see the color. And when you use this modification light, it should match in all the colors, because color changes with the amount of light that goes on that tooth surface. But when you use this light, it should match in every color. Okay? And if you look at it, you got translucency, that size of ledge. You have no raised margins. Let's look at it. Here you go. Did I close that? No, I'm not closing that diaspora because it's going to have orthodontics. Did I put in white spots? No, because maybe they'll change it. And can I put in it? Yes. I'm not the best at that at all, but there are guys who are terrific. Will show you that, and I'll show you the technique to do it. And I'll show you some things you won't believe. And then if you take a look from the incisal edge, you can see the lobes, you can see the grooves, you see the anatomy is there, you can see the lingual surface. I refine my lingual surfaces, and I try to make them as close to the lingual surface of the tooth, of the adjacent teeth, because that's what people are feeling. Now here, it's nice and smooth. If there's a deep cingulum and things of that nature, I'll show you other pictures. I refine it to the backs of the adjacent teeth, because because if people don't feel naturally, they're not going to feel the same way, okay? So we look at it from profile view. You can see how beautiful that is and how there's no raised area. The emergence profile is perfect. And that's the way it looks. So let's look at it here. It's a little bit different. I'm going to do it real fast, okay? If we take a look at this, take a look at it from the lingual. We got a lingual prep. We've long beveled the labial. And I'm going to start to the lingual, make my lingual wall, okay? And blend it towards the incisal. And this is a lighter color change, so I'm using Renamo Nano in this case. And I probably, at the incisal, most incisal edges today would use Renamo Nano, which means I would require a little more opaquing, only because of its handling property. But I could use both, either. Now, we shape it, we form it, and notice how I pay attention to the shape. Shape and form are key. I want, as from the facial, when I'm done, I may be slightly over contoured, but from the proximals, I'm right on time. Because this speeds up your finishing time so much, it's unbelievable. And with Nano, look how beautifully that's sculpted. And you look at it from the facial, and you say, gee, that front might be over contoured. Well, is it? No. Look at all the room I have with a thin layer. Not only that, let's go back a bit. Not only that, it's blocked out. There's no demarcation there. Do I have to use opaquer? No. Don't put opaquer where you don't need it, because you'll end up over opaque. So if you send something that blends like that, you're there. You don't have to do a thing. Now you go ahead. What do? Place your microfilm. Look at all that room I got to place the microfilm. I can put in any effect you want. You want to indent it, size it, things of that nature, fine. You want it to come from underneath, fine. But what I got a beautiful thickness there that I can add the microfill, and that's what I'm doing. On it goes, shaping it with this instrument. You can see, blending it into the two surface, transferring to the thin instruments, the IPC instruments, defining the inner proximal, and keeping the shape and form. You don't want it messy. Cleanliness is next to godliness. I don't know who made that statement, but it's true, especially with bonding. Now, when I polymerize it, I look at it, and people say, do you use, a question that was asked is, do you use a glycerin coating to get rid of the oxygen inhibitor layer? I make one, I don't use it because I'm a sculptor, okay? And not only that, I don't polymerize it because it gets something like this. If I used one and I polymerized it already and tried to get rid of the oxygen inhibitor layer, then I'd have to cut it back and I wouldn't get as near the bond strength as if the oxygen inhibitor layer was there. So I don't use it. Can you use it? Yes, it's great for porcelain, something like that. But that's up to you. You want to get rid of the oxygen inhibitor layer? Doesn't make my polishing any easier. I'm going to polish it off anyway. So I just leave the oxygen inhibitor layer on there. Now I'm polymerized, and I've got something to bond to. In that area right there, it'll go back with a little excess. I don't have to put bonding adhesive on it. It bonds automatically, and I've got no intermediate in between layers, and I sculpt it, shape it, form it, get it where I want it, and I polymerize it, and I'm ready to measure. Is each tooth the same? Okay. When I look at it, that's the one I repaired is larger, about 2/10 of a millimeter, maybe almost 3/10 of a millimeter. I've got to get rid of that. But when you look at it, the sculpting, when you look at the before, the imaginary aspect of it, I'm pretty close. Okay. So now I'm going to finish that back. First of all, I'll start with a disc probably in this situation. I'll bring my incisal edge. I'll get my incisal edge length the way I want them, or the proximal with the coarse disc, not penetrating into the interproximal area, but taking off that bulk with the coarse disc that works for me. Then also I'll use that coarse disc on the facial surface to bring that tooth back into alignment adjacent to the comparable to the adjacent tooth. That's all done with a disc. Then I'll transfer my ET. And the OS1 on the lingual. So all this thing, then I look at my mirror and I say, hey, that's still a little bit too protrusive. I can take my coarse disc and blend it back towards the level of that incisal edge, running it probably at about 7,000 RPM and under control, and it ends up beautiful. I could use an interproximal saw. I don't necessarily like the larger saws. We developed one called the Flexi saw, which is short, and you have complete control on it. We can talk about that later, but it's incredible. Or you can do my torquing method. I don't care which one, okay? And then you finish off with a fine, super fine strip. You see, everything's the same. Hasn't changed from the class 3. It's just going through the steps. And if I want to make sure that I go into the interproximal, notice I take that disc perpendicular to the soft tissue and parallel to the embrasure space and the line angle, and I'll flex over the line angle. You can see that flex. That's what keeps the integrity of the embrasure space and the integrity of the contact area. Because I don't want to blend it and lose that area back in there. That's what starts, what makes the tooth look like a chiclet? Not the color, it's the shape. Okay, so you want to make this shape look exactly like the adjacent tooth. And then you do this all under control and all of the speed you need to do. Going through the polishing system, we could use the rubber cups, rubber points. You can see I'm developing, here I developed the anatomy with the use of a medium point followed by a rubber point, a superfine point. And you can see the characterization, the light reflection off the tooth. It's subtle, it's not big. And sometimes I don't see, I see a characterization, especially longitudinally, as very subtle. And then the light reflectivity really doesn't. You can see the light reflection off that. Turn it the other way, you can see the light reflection in that area. polishing the lingual surface the way we did with the rubber cups, measuring to make sure they're on time. And then I might go back to the fine and superfine disc to even bring up the polish more, because that's what they do. They will not cut, they polish. Notice the flex. And when I do this, it's 15,000 RPMs under the flex. And you put it on the two surfaces and leave it there. You don't, people with discs, they're used to just dancing around it. We don't. We compress the disc and flex it over the two surfaces. That's what really makes the disc work. And in a hands-on experience, I can show you the difference. Now, a little dab of doing the polishing phase. Please, I implore you, don't smear the stuff on and make it tough for your cleanup. All you need is to express a little bit into a dapping dish, put it on the tip of a Q-tip, and put a dab on everything you're polishing. So you don't need to waste it. Not only that, there's no messy cleanup. So you put on your Flexi Buff, which is a chamois coated disc, like a felt fronted disc, and you flex that, and polish it. When you get done, that's what you end up. So this is the invisible class 4, and I can't go through it talk about it much more than that. So now we'll look at it from the inside. So this is an example of a kid who was an incorrigible kid, and I'm a pediatric dentist. When you have an incorrigible child, the way to get control of them is if you can get the parents out of the room, and I always did. And so I handled this kid, and she was a basket case when she came in, and when she came out like this. I don't think you can beat that. I even put white spots in there. The hypoplasia, mimic the hypoplasia in there. You can see it from the inside. Well, it took me about an hour and 15 minutes to do this, but it changed the whole attitude of where the parents are. Invisible restoration. Voila, there and gone. Okay? Let's talk about a cervical restoration. Here you got restorations in Technicolor on the top. On the bottom, immediately post-op. Look, there's a little irritation of the tissue. Okay? Did I pack retraction cord? I don't know. Maybe on the K9 I did. Here's the thing about retraction cord. I don't like it because it traumatizes the gingiva and it really causes welling up of tissue fluid. I'm not worried about the tissue fluid. I'm worried about bleeding. If I see bleeding, which percolates under the restoration, then I'm going to have to backtrack, pack retraction cord, isolate in any way I can. If I see interclavicular fluid, all I just do is blow it away, keep on going. It's never bothered me. And that was shown by Malcolm Jenderson years ago. You could even bond underwater with very good bond strength. So I've always followed that tack. That's why I'm not a rubber dammer. For these reasons, this is the way I do it. Do you have to do it my way? No, do it the way you want. But this is the way I prefer. And I'll put my tissue response up against anybody. So I don't know. Okay. So here we go. Let's do one. This is an older lady that comes in. She's got sensitivity on that molar. She doesn't like the way that the others feel. So I said, well, let's take care of them. Now you got 3 of them here. All right. The 2 bicuspids and the first, and I guess that's maybe a second molar, the way it's dipped in. I'm not even sure. But in the meantime, we're going to prep it. You're going to use a micro diamond. I have a kit that Brasser makes. I don't get anything out of it, but it's their kit. I put all my burrs in it. Micro diamonds are great because they have great access. They're small diamonds and they can get you anywhere you want without creating a problem. So here, down in this particular instance, you've got sclerotic dentin, you got biofilm. How do I get rid of it? Not with a prophy cup because I don't want to irritate the gingival. And you can see the gingival health of this person is impeccable. Why would I touch it? So I'm going to use a burr which I can control, about 10,000 RPMs and copious amounts of water, barely touch the dentin, smooth out the dentin, take the margin slightly beneath the free margin because that's the aesthetic zone. I do not end at the gingival crest. I do not end above the gingival crest. Anything that's cervical, I'm going to take beneath the free margin. Okay? And you'll see why in a second. So I prep it and I freshen up the dentin. You can see the dental margin is now just slightly, maybe a 0.2 of a millimeter beneath the free margin. Then I'm going to prep a long bevel, same thing, clean and neat. You can see the length of the long bevel. Then we're going to acid etch those areas. And here I'll isolate many times with a metal strip. And after I acid etch, I put on my bonding adhesive in our system, which is complete. And think about bonding adhesive right now. Now that I'm thinking about it. You only need one bonding adhesive in your practice, not a myriad. You need a bonding adhesive that will do everything, as far as I'm concerned. You need one that will bond to metal, porcelain, acrylic, whatever, okay? You need a bonding agent that has a catalyst in it, so you can either be self-cured, dual-cured, light-cured, whatever. I'm a total etcher. I will always be a total etcher. That it doesn't take any time to do it. And I know you're going to get the best of all worlds when you total etch. That includes when you're doing sealants. Okay, you should use a total etch technique, etch it, and put on a bonding adhesive or a dent enamel primer before you put your sealant on. That's going to give you a much better seal, and you're going to end up with a much better retention of sealant. So here we go. We go ahead and apply our bonding adhesive. I like the brush because you can tuck it underneath the free margin without doing any damage. You can see how that brush goes right underneath the free margin. That's what's in our kit. We air thin it. Once we do that, this again a sort of a mopperism. It's the most difficult part of doing a cervical restoration is blending it down to the cervical and having it stay on. So when I was doing this, I said, how can I do it easier? So I said, well, let's try a flowable down there, because resin bonds to resin, actually adheres to resin better than it adheres to two surface. So what I do with cervicals is I will put a small amount of flowable microfilm. Now these are what am I going to replace these with? I'm going to replace them with microfilm because it's all enamel replacement. If they were deeper, I'll show you one, I'll talk about that in a second. But these are all enamel replacement, so I'll put a flowable microfill in there. It's slightly underfilled. Notice keeping the concavity, and it actually goes down there and slightly seals the margin. I will polymerize that. Now I take the ellipse of microfill, sculpt it, shape it, and it's going to stick to that area much better. I tack it down towards the gingival and sculpt towards the occlusal. And I'll tack it to the occlusal. That makes it easier to shape it and form it. And you got a much better flow. And so that's what we do. And you can see now I go to my thinner and cleave off the excesses. And once I got that shaped and formed, I polymerize it. Now, there was one of the rats on microfilm is that there's more shrinkage than the other materials than there is. Do you know why I never had shrinkage and never had defective margins? Because this is sort of serendipity, because I knew as a technician, looking under optics, I could not seal the margin with a single application. So I did the best I could to seal that margin, and I polymerized it, got the shape the best I could, and then I polymerized it, and then I added an ellipse of material down there to close all the margins. And I'm placing it against the already pre-polymerized material, shaping it, forming it, sculpting it, getting it the way I want it. And I did one. And the beauty of this, look at the tissue. The tissue is impeccable. Okay? But the beauty of it is I could do all three at one time, and I could finish all three at one time. I don't want to finish the first one. I don't have contacts I have to worry about. So I could do this in quadrants. So this is quadrant dentistry. So now I can finish in a quadrant. I can keep going through this. We'll do it fast. Might start with an ET and refine it. You can see I've got it tipped away from the two surface. Now I go up towards the occlusal. When I get towards the occlusal, I want to refine that and blend it in with a disc. I might start with the ET burr, but that's the way you're going to make finite margins with the coarse disc. Once you get the finesse of feather edging that down on two surfaces where you can't find it with the coarse, then you go through the medium, the fine, and the super fine. And you can see the flex of the disc. And the neat thing about our disking system is the resilience of the paper. It has snapback. It doesn't get crimped. And then we finish it with our polishing paste. So we go from here, that's the way she came in, to here a year later, and you can see the tissue and how it responds. So that's what a cervical restoration is all about. Let's look at these real quickly. This is a kid who had orthodontics, and the braces come off, the patients are horrified. They don't know who to blame. Is it the orthodontist's fault? Is it the kid's fault? Or is it the dentist's fault? Whose fault? I don't know whose fault it is. All I know is I have to deal with this and very unhappy patients. So they come referred to me, and I got to get rid of these hypoplastic areas and the decay that you see underneath. So we do our preps, and now you can see I've got the bevels in there, but I've got deep concavities in there. I can't block that out all with microfilm, can I? Won't happen. Unfortunately, I didn't take the picture, but down in those areas are going to go what? It's going to go nanofill. There's a lighter color change, nanofill, and that's what I placed. I placed nanofill, and after I did my acid etching and everything, I placed nanofill in those deep areas, bringing it up to the leading edge of the long bevel, so you have a continuation of the long bevel. I didn't have to opaque, but if I had to opaque, I could opaque it. Okay, so we placed it in we did that, and then we overlaid it with the microscope, and this is the way the patient walked out. And how much better can that be? He walks out with natural tooth surface and an invisible restoration. So that's where we are. What we're going to attack next time is incisal reinforcement. And like I say, take your questions down. I'm planning on having a whole session on question and answers because they were so overwhelming. It's unbelievable. I hope this explains thoroughly what I'm talking about. Write your questions down. I'm here for you, and we'll be glad to answer it. At the end of this presentation, I'm going to give you guys my cell number. I'm going to give you confidence number. You know that we're here for you, and either my son can answer the question, Bennett can answer the question. If they can't answer the question, I'll answer the question. If I can't answer the questions, I got consultants that can answer the question. Believe me, we will answer your questions. I've enjoyed this presentation, and I talked to my wife all day. She's looking right at me. She's lovely. She's beautiful, and I want to thank my staff for putting together such a nice, for putting up with me through all this endeavor. I hope everybody's well out there. Be safe, and I look forward to the next presentation. Thank you. Bye-bye.